Hi everyone, Dr. Nemechek here on the road, recording from lovely Clovis, California. I'm here visiting my mother, and just as a quick reminder, hit the subscribe button so you can stay abreast of all the new videos that we're posting. And this video is today's weekly viewers' questions answered. If you don't see one of your questions here, go ahead and post them in the comment section below, and we'll make sure we get to them next week. When I eat, first one. When I eat, I feel dizzy and I have abdominal pain. Multiple consults with surgeons, gastroenterologists, cardiologists, can't find anything wrong. Can autonomic dysfunction, mentioned by a neurologist, cause this problem? Absolutely. When the primary problems that people experience with autonomic dysfunction is they have low blood pressure in their brain, otherwise known as orthostatic intolerance. And this causes a wide range of symptoms. This is, I can't think, I can't focus, I'm tired, I got headaches, I got neck pain. But it can also cause chest tightness, chest pain, and abdominal pain. And now, if you have abdominal pain, the more likely thing is you got to make sure your gallbladder's okay, you don't have an infected appendix, you don't have pancreatitis, so you need to see gastroenterologist, general surgeon, make sure that's okay. If they're kind of striking out, this could easily be, and your labs basically are normal. This is often autonomic dysfunction, and our protocol turns this around fairly quickly. So give that a thought. Can inulin help adults, or do adults only get rifaximin? Yes, inulin can help adults. I've got a video coming out soon about its benefit in rheumatoid arthritis and reducing symptoms, both intestinal and in terms of inflammatory pain. It's just a bit harder. You're using inulin to get reversal of autonomic dysfunction, not impossible, and can maybe get you partway there. So yes, it can help. When you have substantial autonomic dysfunction and central nervous system symptoms, continuous rifaximin is almost always required at this point. Are there antibiotic options to rifaximin? Yes. Now, first, you got to divide your SIBO, bacterial overgrowth problems, into kind of recent or long-term. If they're kind of recent, what's that mean? 6 months? You had surgery, and ever since surgery, I got all these symptoms. I think I got SIBO. A short, like 10, 14-day course of Cipro, ciprofloxacin, augmentin, zithromycin, metronidazole. These all can, have a decent chance of reversing SIBO, and you'll stay reversed. But if you've had prolonged symptoms, now we're looking like a year, a couple of years, things are getting worse. What happens is your small intestine, the autonomic nervous system that drives it kind of regulates your small intestine, is not working correctly, and the small intestine is going to slow, and that causes rapid relapsing. So if you took 10 days of Cipro, within a week or two, people will be like, oh, it came back. It didn't work. Well, it did work. It's just that the intestinal tract is going too slow, and you've relapsed. That's where the rifaximin comes in. These other antibiotics I mentioned have substantial side effects and toxicities if used over, several months at a time. And there's a high risk of drug resistance, and then they won't work at all. With rifaximin, very safe over long term, no drug resistance we have to worry about. And so that's where most of the people that come to me have had more prolonged issues and need continuous rifaximin. Let's see, next page. Does fish oil increase histamine? Not directly. Now, the whole fish histamine thing got started back in the 70s and 80s. There's a thing called scambroid reaction. Scambroid's a fish commonly used in sushi, or at least it used to be. And there would be reactions people would get from eating sushi and from this fish. And what we now know is it wasn't really the fish. It was the fish wasn't refrigerated properly, and bacteria started growing on the gills making histamine. That's really what it was. It wasn't really in the meat. But now everybody's thinking fish histamine, okay? If fish oil does trigger a histamine reaction, flush, red, itching, maybe hives, that kind of a thing, you got leaky gut. That's what's doing it. Because that reaction can happen with olive oil, with all sorts of stuff. And I've had many, many patients, whether it's fish oil or all these other things. Once you fix the leaky gut, and here we'd be using rifaximin, and then you got to use glutamine to deal with the COVID leaky gut now. Once you would do that, patients can eat these foods and not get a histamine reaction. Okay. Fifth one, can VNS trigger headaches? Yes, sometimes, especially if you're kind of fragile, and you're new on therapy, or like I had a concussion about a month ago, and I posted about a week after the concussion, I tried to restart my VNS and it was giving me a headache, and so I held off another couple of weeks. It's not bothering me. So actually what I do in practice is we very rarely start VNS on the first visit. I want to get people started. I want to get inflammation down. They start to stabilize. They can tolerate things better. And then in a few months into the protocol, we'll assess if we need to add the VNS at that time. And if we do, we rarely have any problems. It's very, very well tolerated. And finally, I keep relapsing a few weeks after I finish a 14 course of rifaximin. Why is this? This gets back to my earlier point. If you have slow intestinal motility, and it's hard to know if you do, you don't necessarily have symptoms, you relapse quickly. And so what do you do in this case? Well, you got to control inflammation for many to several months. So that what that means is your fish oil and olive oil, maybe VNS, and then nonstop, twice a day rifaximin for a minimum of 4 months. And then at that point, we may stop and see how you're doing. Sometimes you're like, no, he's not recovered enough. We may go, a total of 6-8 months with rifaximin, and then we'll stop. And many times at that point, they don't relapse. Or they will relapse at some point, but it's not right away. It might be several months, and they'll relapse. And then when that happens, you only need 10 days of rifaximin. So that's it for this week's questions. Again, if you have some you want to have answered, put them in the comment section below. And other than that, everybody, take care of your kids, take care of yourself, keep your inflammation down. And this is Dr. Nemechek. Have a nice weekend.